Hi, my name is Candy and I'm your nurse today. Would you like to go ahead and verify your date and or your date of birth and your name for me?
Jane Doe, 11/20/1962.
Okay, let me just check the bracelet. All right, I'm going to go ahead and do a postpartum assessment on you. I'm going to go ahead and ask you a couple questions and we'll give you a couple teaching points. And if you have any questions for me, go ahead and feel free to stop me at any time. First of all, we're going to go ahead and we're going to assess the breast area. We're going to assess the breast area for softness and tenderness to make sure that there's any warmth or edema or any pain. We're going to ask her if we're going to look for the areola area for dry or any cracking skin. Secondly, we'll teach her at this point if she is breastfed or bottle fed to make sure she goes ahead and invests in a very supportive and form-fitting tight bra while she's going through the feeding process. The next thing we're going to do is we're going to assess her abdomen. So at this point, we're going to go ahead and we're going to see if there is a C-section there. We're going to look at the incision site. We're going to look for any inflammation, swelling. We're going to look for any tenderness. We're going to look for any warmth or any redness, discoloration, and we're going to assess her pain level. If everything looks normal there, we'll go ahead and then we'll listen to her bowel sounds. We'll listen times 4 quadrants. We'll start make sure that she has either hypoactive or hyperactive bowel sounds. Her bowel sounds are all normal, and she does have hyperactive bowel sounds. Then we would move on and we would assess the fundus. So we would support the we would support the uterus, and then we would palpate and feel. And so then you would go and depending on, let's say she is 1 day postpartum, you're going to feel at the umbilicus, and you're going to go one finger down, and then you should feel and you should be able to palpate the fundus so that you're going to feel and make sure that there's no abnormal disease there and there's not any pain, anything that we should be aware of. At that point, we're going to go ahead, we move down. We ask her about her bowel movements. We ask her when her last bowel movement was. We ask her if there was any discomfort. We want to make sure that after stress and after pain medication, sometimes that you need either a stool softener or something to help you with that bowel movement process. Then you're going to ask her about her urination to make sure that she doesn't have any burning or burning sensation, any discoloration, any foul odors, or any abnormalities that I need to know about. At that point, we're going to kind of we're going to teach her a couple of things about her lochia. We're going to look at the pads, because at this point, every mom has a pad. We're going to look at it. We're going to teach her that there's a bright red, and that's going to be completely normal. But as she progresses through this period, she'll go down to a pink, which is the serosa, and at that point we go down to the serosa, and then it's a serosa and is the pink. Then we go down to the alba, which is the no discoloration. Okay, so we'll move on. So we're going to teach her about the process and her bleeding, and then we're going to ask, it's a light color, so the alba is a light color. And then we're going to teach her that if there isn't a difference either way, if she either increases in the lochia amount or she decreases, that she needs to notify her physician. At that point, we're going to teach her about any adverse reactions such as swelling, pain, inflammation in the incision site or any area. We're going to teach her about educating herself on a healthy diet and making sure that she maintains proper intake and output. We're also going to talk to her. We're also going to look at her extremities, upper and lower bilaterally, to make sure that there's no swelling or warmth or edema or discomfort. At that point, we're going to go ahead and ask her if she has any questions for us. Do you have any questions for us? Okay. Do you have any pain anywhere? Okay, so we're also going to, at this point, we're going to teach her about a car seat. We're going to ask her if she has a car seat ready to go. We're going to make sure that she has all guidelines, she's following all guidelines, and everything, or she and family is educated on how to use the car seat. We will also teach her about shaking the baby and about how important it is to make sure that we don't shake the baby. If at anything she was to call someone and if she wasn't able to reach out, then maybe she could just go ahead and set the baby down on her back and walk away. Therefore, babies don't die from crying, they do from shaking. So we teach her on the importance of not shaking a baby. We also teach her about the importance of laying the baby on the back, making sure that there's no blankets or pillows or any kind of bumpers or pads to make sure that the baby is as safe from SIDS as possible. If she has no questions from there, we go ahead and we make sure she's comfortable. Anything that she needs from us, she has her call light in reach, her bed's in the lowest position, and that we let her know that we will check back in to use the call light if she needs any help.